How's life, Dave?
Life is so good. I'm in the mountains right now, so it's
Back to Mount Shasta.
yeah, if I could show you, let's see, out my window, you can see a little bit right next to a pine tree, It's it's pretty amazing. It's pretty awesome. Thank you,
I am.
Star.
Yeah, your view is much better than mine. So I'm at the national office, everybody. So and it's really the surroundings are pretty industrial.
Ooh,
It's a
that's a good
I
way
don't
to
know if
put
you
it.
can. Let's see. I'm gonna peek out the window for you. Anyways, it's hard to tell, just parking lot
Yep.
there.
Office
But
buildings, yeah.
yeah. Oh, there
I
goes
like
my
it
light.
though. I bet we should at some point we should give people a tour of the office.
Oh,
Maybe one of
totally.
these times when we're both in there, we'll hook up a second camera and we can go through the office and just
Do
say
a
hi
little
to
walk around.
people. Yeah, do a walk around. We do have more and more people that are in the office now, so or starting to kind of come back to the office or at least a few more days a week. So
Yeah.
that's cool.
Jamie King, our friend from Kentucky, she's joined us. So, Jamie, are you at home or in the office today? We had Dave and I had a town hall, an AAPC town hall. So quarterly, we Bevan leads a discussion with a company-wide discussion about updates and what's going on, and we had that this morning, which was fun. It's for those in the office, we're having some food brought in today, which is always a good time to see everybody. And we missed Dave, because he's just traveling around. But we saw you on the big screen in the call today, so that was fun.
Yeah, I got featured on our town hall unexpectedly and for no reason, but stuff like
You're the best looking guy, and we needed
that.
that on the screen.
Whatever. I'm no AAPC Alex. Everyone knows
No,
that. So,
oh,
but it's
no, geez, I wish we could talk about some of the things there's so much happening and a lot of technical type of things. So, um,
we've got a lot of
uh,
back
uh,
end. Uh,
yeah,
yeah, we've got a lot of back end systems that we've been running on for a couple decades that are just outdated, and we've kind of been cobbling things together as we've grown, and we've grown so much as a company. And our membership has grown
oh
exponentially
yeah,
as well. And so it's just trying to keep up with all of that, but using old technology that just isn't built for our model of business that we've grown into.
yeah.
And so, yeah, a lot of our town hall was talking about those old systems that we're still needing to use for the time being, but creating these new or using these new platforms that will better service in the future. So,
Yep. Exciting for us internally, and you will see the benefits of those in some form down the road, but there's a lot happening here at the national office. And there's with that, speaking of exciting things that are happening, I posted on our social media channels this morning about a workshop coming up, our May workshop with Rhonda Buchholz, our future uh, NAB president elect, I guess is what we call her. But she's amazing. She's the first person I worked with when I started working at APC because she was driving our ICD-10, ICD-9 to ICD-10 transition. Remember that, Dave?
that's right. That was a big deal. I'm sure all of you remember that if you've been in the industry for the last, 6, 7 years.
Yeah.
Rhonda was like spearheading that whole transition for us. So it was a
Oh
big
man.
job for her.
And I remember going out to some local chapters at that time, and if not that, I don't want to say that it was uneventful, but it was less scary than we thought it was going to be. But you're prepared, so that's always a great thing.
Yeah, it was like Y2K, right?
Yeah, yeah,
Oh, it's coming, it's coming, it's coming. We got to get ready for it. We got to get ready for it. And then it was like, okay, too
yep,
bad.
yep. There we go. Yep, it came
Still,
and
we're
went.
still alive. Yeah.
That's right. That's right. But let us know where you're at. I see a handful of you guys out there. Let us know um, where you're working from today. Jamie, we haven't heard if you're in the office or at home working today. Another exciting thing that we've seen a lot of pictures of is everyone's May Mania events, which has been so fun. I know Brian Van Norman, who works at the national office, has been to a few. He went to a luau, which sounds great. Um, and yeah, just a lot
Did
of
he go to one of the
exciting meetings.
Hawaii chapters? Did he luck out and
No,
go to
no, that'd
Hawaii?
be awesome. That'd be
That
so
would be
great.
awesome. Like, yeah, I got to go visit some chapters. Let's see, Hawaii. I
Yeah,
think we've got a chapter in Thailand.
yeah, Spain. Yeah, that'd be
Yeah,
cool.
over in Europe.
Uh,
Maybe we should start trying to pitch some stuff like that. Let's go on like
that's right.
you and I will go on like a European tour to promote AAPC.
I I don't know if Ray's ever brought this up to you before, but she's talked about a tour, a bus tour, and then you and I, and like, and Ray tour chapter meetings across the country.
I love that.
And outside of the gym, I go to, there's this big orange Optum RV, mega RV. And I took a picture of it and sent it to her once. I was like, that's it. That's what we need. Just obviously it'd be APC green with our look on it, but that'd be a blast.
That would be so cool. And probably a good idea to have an expert with us like Ray, a subject
Yeah,
matter expert that could actually talk intelligently about
that's right.
you know.
Yeah, your needs. Yeah, our members'
Yeah.
needs.
We'll get everyone together and then yeah, and then we'll have Ray
Yeah,
do her thing. She's so
yeah.
good. We use her for so
She's
many
amazing.
things.
Oh
Yeah.
my goodness. Rhonda Bottoms from Missouri. Hey, thanks for joining us today. I don't recall her name. Rhonda, is this your first time watching with us? I've never seen this name. Liesel Ivuma. I hope I said that right. From South
Right.
Texas. Um, and Naya Raman from Virginia. Hey, thanks for being with us. Kimberly Shutters from California. Hey, she might be near Mount Shasta.
Yeah, Kimberly, are you near Mount Shasta? Do you want to jump on our social hour right now? Just kidding.
Yeah, yeah.
Um, I love California. I grew up in California. I don't know if you knew that, Alex, but
Oh, I didn't.
I was like 12. So coming back here, it's like there's a lot of familiarity and stuff, but and obviously Mount Shasta is like just this, it's like this, it's like this temple in the mountains. It's really cool.
She's in San Diego.
Ah,
Be another beautiful area.
great too. Yeah. My other favorite place in California.
That's right. Okay. I got to show you this. I needed something to hold up my computer for this webcast. So I grabbed a stack of Jacob Swartzwelder
It's on the
AAPC, the
cover.
magazines, a pile of them.
Is
So
that
Jacob,
which issue is that?
oh, this is April. So last month.
He was on last month. That's
Yeah.
so cool. Where did you find those? Were they just
They're piles of magazines
cool?
around the office. Yep. Yep.
Nice. I'm gonna have to take them. Our creative team are like they've been taking such great pictures and headshots to use for the magazines. I've been really impressed.
Yeah.
So
It's an amazing overhaul of the magazine. It looked good before, but
yeah,
this is more in line with who we are, I think.
yeah. And I yeah, I don't know. I don't need to bring up the how much money we spend on things because we really, man, we work on shoestring budgets for a lot of these things. Even our conferences, we barely break even. Often we don't break even. And so
Yeah.
sometimes they're just more of kind of a member benefit.
Yep.
Um, and so when we
Absolutely.
overhaul things like the magazine, it's not like we're pouring a bunch of money into it or anything. We're using our creative talent with our creative teams to just make it more visually appealing and
Yeah.
add more elements to the e-magazine videos in there. There's ebook tips, there's codified tips in there. So if you're not, I guess this is a pitch for the magazine, both digital and print. If you're not, I mean, it's a free benefit that you have as a member and you can get CEUs from certain things in the magazine. So check that out.
Yeah. Yeah. Uh, while you talked about conference a little bit, I thought about our guests or our viewers may find this interesting that food is it's probably maybe one of the most expensive costs of conference. And that is one of the hardest things to nail because everybody has specific needs and some people may love it, some people may hate it, and we're always trying to nail that and get it right. And I think we've gotten better over the past few years for sure.
Yeah, we have. The numbers are staggering though when you actually understand the cost per person, what it cost or per person per meal.
Mm.
So think about that continental breakfast that we had a couple days where it was just like a couple muffins and just a piece of
Yep.
toast. Those are $60. Well, okay, it depends on the place, but it's somewhere around $50 to $60 per person per meal.
Mm.
And it's like, it's just, it's
So much.
it's really expensive. And I don't think people understand all of that. So we know that you guys definitely invest, a lot of you invest your own hard-earned money, or your company will pay for you, but it's still, you got to travel. There's still an expense to it. Just know that it's shared amongst
Yeah.
all of us, and we're
Yeah.
all in it together, but really just to better ourselves and to better the community. And yeah, we do it for
Yeah.
the education.
That's right. That's right. Real quick before our guest comes in, who is Dr. Church. Speaking of HealthCon, our buddy from HealthCon, who we have gotten to know for many years now, he'll be joining us. But I wanted to touch on this, Dave. Electronic exams. Um, we have evolved so much over the last few years since, like, we basically just dropped it on the AAPC world because we had to due to the pandemic. And it's gotten so much better every week, every month, every year. And I would say we're humming pretty well right now. Um, but I
Yeah.
know we see my concern. I mentioned this to Dave before you went live, just how occasionally we'll see someone in the Facebook group who does not have a good experience. And I'm not, I say this to not dismiss anybody's feelings or experience, but the majority of the time when we see those situations, it's because they haven't read all of the instructions. There's so much to research and know. You kind of have to put on that medical coder hat of being in the details, and there are a lot of details for the exam. Dave, you know this better than me.
Yeah. Because I've had to take those instructions and put them in a way that's presentable and readable or whatever, just digitizing stuff. But it's so much, so many things are missed because people just, they'll skim through the instructions. And this is something, your CPC exam, your career, your potential livelihood, you don't want to skim through that.
Yep.
The biggest, the biggest tip that we could ever offer is just read the instructions because
Thorough, be very thorough about that.
and it's usually one or two people that just don't read and have a bad experience, and then they make it seem like it's a bad experience for everyone.
Yep.
And really, we've got people QAing our exams, the whole process. We're having to go through the process and document it, screen record all of it so that we can do tutorials for it. So we're going through the whole exam process very meticulously.
Yes. And speaking of recording, we record each one of those exam sessions to monitor and just in case an issue does come up. And I'll say this because I deal with this almost every day, that when someone shares their poor exam experience, we go back and watch videos of that. It's generally because they missed a few things on the instruction list. With that said, we haven't been perfect. I'll throw that out for sure.
There's
We
still
are
kinks.
fallible. Yes.
Yeah, still
Yeah.
kinks and still things that we're working out. But again, we're all in this together. So as we're using these new platforms and technology, I guess, yeah, just your understanding and patience is also helpful to us too. Your feedback's helpful too. It's all helpful. It really
Yes.
is. So
Yep.
I think it's just staying positive about it. And
Yep.
there's always that.
And if you read the instructions before your exam and you have a question, I would, or if you're not quite sure, ask in the Facebook group, give our customer service team a call, just iron it all out so no stone is unturned. So,
Yeah,
all right.
definitely don't wait until the day of your exam to read your instructions that were sent in your email.
Yeah.
Yeah,
Yeah.
there's emails that go out. We've got tutorials, links to all of those.
Yeah.
There's so much to learn and to know about your exam. You should be going in fully aware you know, of how it's going to go. And
Yep.
then if you are and you're prepared in that way, you will have a great experience. It really is tailored to have a good experience if you read. So,
Yes. 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 Well, Dave, should we get our guest in here?
yeah, let's bring in Dr. Church.
All right. So while Dr. Church enters, hey Kimberly, she's been to Mount Shasta, Dave.
Oh,
She's been to Mount
oh, when
Shasta.
during COVID, beautiful,
Yep.
but the lake was really low. You're talking about Lake Siskiyou, just across from Mount Shasta. Yeah, I'm camped literally right next to it, and I think it's back up to where it should be. It's beautiful.
Now,
Dr.
speaking,
Church.
yeah, speaking of unique places, I was just looking up Dr. Church's home city from his bio. I can't even say that, Doctor.
Depends on where you're from. Some people say Hiawassee, but if you're from around here, you just say Hawassee. So it's an Indian name.
All right. And
A lot
that's
of
out in
Cherokee
Georgia.
Indians in this area. Excuse me?
That's in Georgia.
That's right. So we're in the mountains of Georgia where the Appalachian Trail goes through. So we kind of a unique rural area it's kind of remote, but people seem to find their way here.
Awesome. Now, we love how involved you are with AAPC, and it's very unique for a physician to be as involved with the organization as you are. We're going to handle this broadcast like an I am AAPC interview. So Dave and I are just going to fire questions. We want to know everything about you, how you ended up in the medical field, and your journey with AAPC and beyond. Would you just give us a little bit of history of how you chose to be a physician, about that path? Did you always know that you wanted to be a physician?
Well, that's an interesting journey in itself. My father was a physician and he was a radiologist, which was not attractive to me. That dark room was always a little scary to me when I would go visit. Um, but he was also a family doctor before he did that. Back in the old days, you you did your training and you went out and everybody was delivering babies and all this other stuff. And he loved that, but ended up going back for the radiology stuff. But he never gave all that up. He didn't deliver babies, but there were people that would come to our home or he would make house calls and see people, which is not what radiologists do. And so when I would see people coming to our home and my dad communicating with a pharmacist who would go in after hours, that really was special to people. And that was really what I wanted to do to help people in a way that was kind of unique. And so that's what I'm getting to do here up in the mountains. So some version of that.
That's so cool. So are you family practice physician then? Do you have your own practice, or tell us a little bit
I have a private practice now, and with a couple of physician assistants working with me. And there is another doctor in the area, but this is by far the largest practice. But because of the rural area, the mileage kind of extends out beyond the borders of our town. So, but it's fun. You certainly can't go to the grocery store without someone seeing you in every single aisle, which is, I love it. It is
in every aisle,
every aisle. So,
asking for prescriptions and stuff on the spot,
Yeah,
probably?
I
they'll
hurt
ask my
right
wife
here.
about labs. She's like, I don't know. It's
It's great.
but
Uh,
but my home number's in the book. It's just about taking care of people, and if you love what you're doing, um, I think at one of the conferences a few years ago, I think in the opening session, we talked about this ikigai, where you can make a living and you're good at something and doing something the world needs, and that you love it all. I feel like I'm getting to do that.
That's so cool.
that's
And
so great.
that truly is the model for success, whatever that means to you. But it's got to have the passion, it's got to have the purpose, it's got to have, those things.
It's about fulfillment, and that can come in lots of versions of things for sure.
Dr. Church, I'm curious. So, being in a rural area, you probably handle so many different things that a general practitioner in a city may not. You probably handle a wide variety of situations.
Oh, I do. Now I do work in the hospital as well, and sometimes in the emergency department. And when I have students and residents come here for training with me, they've had their training elsewhere, and they'll come and present a case, and then say, now we need to refer them to this and this and this. And it's like, well, it's 2 hours to get to that. Like, and why do you really need that? Like, so what are they going to do next? And this, we need our specialists, so don't misunderstand me, but like, we just take care of them. And there's lots of things that I'm able to do as part of my training. And so if there's a need to drive 2 hours, well, we will make those arrangements. But most of the time, most people just need that stuff that I can take care of right here in the office.
And
That's good.
it's interesting because I would say that you're passionate about the revenue cycle side of healthcare. Is that true?
Ah, goodness.
Or how did all this happen with medical coding and this back end piece?
Well, I mean, I think it really starts for me with taking care of people. And I was, I guess, and traditionally primary care has not been the most lucrative specialty. Um, but then if you do a little deeper dive, there's enough revenue if you code right to be fine and to take care of your staff well and to maintain a place to work that's like a family and that people look forward to coming to work to. But it's much more than this extended family for a small business. It's about taking care of people. So we start with good care, and then, oh, by the way, if you code right, you can do well.
And you
So
can
it's
provide
not
even more
about
good
the
care.
revenue cycle first, it's about caring first, and we can help take care of people better when we can afford to pay our staff above average and we can do all this other stuff. And so that's really what's driving that. I have people, sometimes doctors will read an article and call me and say, oh, my practice is failing. Can you help me make more money? I was like, well, let's figure out why your practice is failing. Maybe it was that they just were terrible coders and they were doing great, but it is not about some gimmick on which code that you can sneak in. This is about doing what's right, and then the rest should work out.
Yeah. Like kind of how Alex was saying, you're a bit of an anomaly, right? Because you're a physician, but you also know this revenue cycle side of it. Is that because you've been just a small practice and you've had to do wear a lot of those hats? Or how did you get into doing more of that side of it, which a lot of physicians just don't even want to touch?
Yeah, you're right. I think and unfortunately I am an anomaly. I think there are some things when you're in a small business that you either figure out at least an imperfect better way, or you just get away from it to let somebody else handle it. So there are those two different groups, but well before then, when I was in my training in the family medicine residency, after medical school, there's additional 3 years of training. There's some practice management that's required, but the people who were teaching it weren't necessarily well trained, and they did their best, but it was so complicated, and I found myself trying to apply the old E&M guidelines properly, and I'm like, this is just can't be this hard. It's like an NFL playbook, and it turns out it was that hard, and if you're trying to do it perfectly right. But then I'm going to do a deeper dive and study this on my own, and so I learned a few things about, well, gosh, I can never bill a level 4 visit if I don't have 4 history of present illness items, for example. So, and it didn't mean that everything was level 4, but if I just started off knowing some infrastructure of the code requirements, that helped so much instead of every time I was starting fresh with each note. And so it really freed me to not be so constrained about memorizing 10 rules, how many review of systems and all this complicated stuff. And then there was a meeting where I was just sideline a doctor about this little trick. And that wasn't against the rules. It was just like, oh, nobody ever told me this before. It's like, well, nobody told me. I just discovered it. And so then there was these small groups that started huddling up, and then I became involved with the American Academy of Family Physicians, and I think they saw that there was a different set of lenses that I was looking at, and so part of this, I did get better at it after a bit. Then you start answering questions, but the other part of things that was driving this conversation is is a lot of doctors who got inspired with medicine like I did, like wanting that house call scenario and people counting on you to kind of help them through these difficult times and on a journey, not just this one episode for a procedure. There are a lot of people who want to do that, but as a specialty, if they couldn't afford to do that and they've got all these big loans and stuff, they were driven out away from primary care. And we also know that primary care is critically important for, I mean, we spend less money and reduce people from going to the hospital and stuff like that. And so I felt like being on this mission to help revenue not be the barrier to choose that specialty if that's what your calling is. And so I kind of embarked on that, really on a journey to help the country for medicine, which does not make sense for some country doctor in the middle of nowhere, Georgia. But AAPC is helping me on that path, and I'm getting to share some of my passion for proper coding and trying to make this complicated mess less complicated. And so that's been fun doing that. But it's really, really part of a bigger mission of improving healthcare. And I think we can do that through coding.
How did you stumble upon AAPC, doctor?
So through my journey with the American Academy of Family Physicians, I became one of their advisors for the team that goes to the CPT editorial panel. And I'm not sure how much the audience knows how this works, but that big book that we use, somebody has to make it. And the panel doesn't do that by themselves. Every specialty just about has representatives at this meeting that happens several times a year. And we argue about the semicolon and the arrangements of these things, and they still won't get it perfectly right all the time. But so for 5 or 6 years, I was working as an advisor for that. But then what I also knew is there's a lot to this that I didn't know. I thought I knew what I was doing. And I would say most people did not go this route, but the staff, the faculty, or the staff liaison that was with me, she had multiple AAPC certifications, and she just had this language that I didn't have. And so I was like, I want to go through this training. I just felt lost. Like people were using these words that like I thought I knew a bunch of stuff, and I do, but then I didn't. And
It's
so
different lens, like you're saying.
it is. And so I went through the CPC training, and so that was a really difficult test. And so I am so glad I did that. I did not do that so I could become a coder. Because I can't. There's so much more besides that test with payer policies and all this stuff. I can't keep up with that. But I think it helped me have just a huge, greater appreciation for the coders. So when I see those credentials, I was like, oh, I know what that means. That means how much I don't know.
Yeah, it means they know what they're talking about.
They do.
Good.
So that's helped me. And and that's been a secondary journey for me, is to help educate doctors. Like, well, when a CPC coder gives you some counsel, they don't know all of medicine, but they know more about coding than you do. And so give them a break. And so anyway, that I've been on a journey for that too. Every time I speak with doctors, I remind them of that.
I spoke with the MBA who also carries their CPC, and he said the CPC exam was harder than any graduate school exam he had taken. And it's interesting to hear from you, who you've been through a lot of education, doctor, and to hear you talk about the difficulty of that exam. Tell us about that experience a little bit. About were you surprised that it was as tough as it was?
Well, yeah, I mean, I'd prepared, and I've taken a lot of exams, but I thought I was going to do okay. I'd done some practice exams. Of course, I'm working full time, and all these places. So this was like a side job trying to prepare for that exam. And what I'd never taken an APC exam before, so I didn't know that people were taking different exams for different things, and I was just sweating when some people left after an hour or an hour and a half. It's like, oh no, that either they gave up or they are just so good. I was like, because anyway, at the very last 5 minutes is when I finished, and it was hard.
Which
Yeah.
passed it.
And I did. So, but I still use every minute of it. And I've since taken another exam, the risk adjustment, CRC exam as well. Also a hard test.
Yeah.
I think it says, like you said this, doctor, just that it says a lot about our members who are certified, and for them to be able to pass that exam, and it really does give them a unique outlook that many clinicians don't have. So I appreciate that support and that feedback.
I guess the flip side of it is when I talk to a coder and they're like, well, you're not certified. It's like, well, yeah, I am. So, but I will give it to you that I don't know everything.
Yeah.
But it gives me a little street credibility in those conversations. They know that I'm not starting from a position of not understanding some of the compliance rules and things like that.
Yeah, you can speak that same language more easily, right?
Yeah, so I think that helps in my communication, then we can have some dialogue. And so that becomes a fun time too when I'm kind of co-teaching things with a real coder, as I call the real coders, that I can be a more collaborative, but I've got this, the doctors will chime in, but this and this and this, like, well, hang on. From the coder's perspective, this is what they're seeing, and you just didn't say that in your note. And so with a lot more credibility with the doctors, I can speak up there too. So that's been an interesting journey too.
Yeah, you're a bridge, literally, kind of connecting those two worlds. And in our CPC training, we talk about how to communicate with physicians, as a coder, how to communicate with physicians, but to have another physician that can communicate with both groups, fluidly like you do, and do so eloquently and so humbly too. I think that's something that, not to embarrass you, put you on the spot, but a lot of people look at you and they just love how down to earth you are, but so knowledgeable with it too. You're never condescending. You never make people feel, you know, less than or whatever. They can just tell you just have a good heart and you really care.
Well, the truth is, coding is humbling. So
There you go.
um, I think if I started acting like I knew it all, I mean, I've been in a lot of APC meetings now, and there are plenty of people in that room that can talk circles around me. So I know my place there. I'm privileged to be there. I'm always a little afraid when we're getting this. It's a little easier on the panel because I can say, "Well, why don't you take that, Ray?" So
Right. Except for
Speaking
when
of
it's just you. Yeah.
speaking of which, your presence at AAPC conferences has has grown over the last few years. We see you more often. You're sharing your knowledge. Tell us a little bit about what information do you share? What kind of sessions do you present at conference?
well, so yeah, I think for a little while I've been sitting on a panel on the main stage panel, which is an E&M communicator, and that was before I moved into the editorial panel role. And I guess part of that is, I mean, there are plenty of other great docs that are on the advisors and panel at the CPT meeting, but I think, but as a primary care doctor who uses E&M like multiple times a day, it adds an interesting perspective to it. And I think the fact that I also had my CPC certification gave me a little street cred to come up there. And then separately, I think Ray Marie is present at those meetings, phenomenal. And I was always like, oh my goodness, when the chair says, Ray, what do you think? And everybody's like leaning in to hear her perspective. I wanted to so I started developing some relationships with her as well, and I think it's a nice chemistry when we speak together. And then every now and then there's some topics that may be kind of new or emerging that I knew were going to be new and emerging because I knew about the topic because I helped make the rules. Um, um, and so there's so many great communicators from the coder spot. I don't want to take up those speaking slides, but sometimes it's nice to have another version of it from the clinician perspective. So I do want to be careful sometimes as a panel member, what I say. Some people are quoting me like it's that I'm making new rules, because I'm not doing that, because the rules are what the rules are printed. But there is, when we're talking about what is the intent, but just because I can share that perspective doesn't mean that Medicare doesn't say, well, regardless of the intent, here's how we're applying the rule. So this stuff gets complicated quickly, but I think that's been part of that journey, is I've been able just to share some nuggets along the way with some new and emerging topics, and sometimes some topics that would not otherwise make it. Like I did a session at FMX this last time about tag team coding, with how we do some teaching in a residency setting, and bouncing back and forth, and what a great dynamic that is.
I'm curious, with your knowledge that you have, this unique knowledge that many physicians don't have, how do you have what's your relationship like with your coders? And like, do you think it's different than it is with other physicians, family practice physicians?
Probably, and I don't want it to be this way, but like, even when I was taking my CPC training, I already had this other set of experiences and lenses of things, and whoever the coaches were on the other end, they were like a little slow to respond, because I was asking some questions from a doctor way, like, that wouldn't have come up otherwise. And like, and so I think it can be a little intimidating. I don't think I'm intimidating, but it still happens sometimes. So I think I anyway, that's been a little tricky sometimes to navigate. But I think my relationship with the coders that help me is very collaborative, and if they say no, definitely this will not work, I was like, okay, thanks for. But I also, because of some positions that I am in, I'll say, well, it should work. Let's figure out why. Let's raise this up on a national level to get a payer statement on that. And so I do have some other mechanisms that aren't really available to everybody else. Not because I'm just trying to abuse a spot, but it's more because I'm able to reflect some things. Because a lot of other doctors will send things to me and have complaints and concerns. And so it's nice to be able to elevate that when the time is right.
Yeah, it sounds like you've got, like you're saying, mechanisms or positioning to do that, to bring those things more to the forefront. And it's interesting, because in healthcare, there's so many compartmentalized areas. Everybody, you might think it all flows together beautifully, but it really doesn't. We need those bridges. We need people like you that can see the bigger picture, right?
And interesting. I mean, I'm in private practice. Like, this is, none of those roles are like paid roles. It's only because I'm like, my colleagues are struggling, or this is a problem. And so, but this is my Netflix binge. I go study codes. It's kind of fun, because I do feel like we're making a difference. I'm part of a bigger picture of making a difference together.
Yeah, that's awesome.
Did you ever go talk to your coders when you're studying? Did you say, hey, help me understand this? Can you imagine your doctor coming in, them knowing that you're preparing for the exam they prepared for and completed?
Well, my practice looked a little bit different then, but I didn't really even know who to talk to, and I was not drowning, but there was so much new stuff, like pacemaker placements and all this other stuff that most coders, if you don't do that, you're not going to be up on it. So I just had to be diving into the study guides and study materials.
And being in family practice, right? It's such a diverse range it's not like a specialty where it's like, okay, it's going to be usually around this subset of codes, right? It could be so many different things.
And now I've also had some doctors asking me about, like, well, should I get this certification? And so I have some mixed feelings about that, because it is a hard exam putting yourself through that, for most family physicians, that like they don't need to learn about pathology, billing, and coding. I guess for me, because of being on the panel, it's like I don't want to be in the dark when I hear something about X-ray stuff. But I think can I think it can still be helpful to understand how this puzzle fits together, even if you're not doing that as a specialty. It's a good education. But then, of course, there are some specialty specific exams that might be more appropriate for some of them. And I've talked to some doctors who are now working for insurance companies, and that's a great certification and training for them to do that. So, but it's not for everybody.
Yeah,
Well, it sounds like it's something you're kind of passionate about anyway, right? It's your Netflix binge. So you're like, I want to know what's coming out, what's
Well, I just felt so uneducated, and then after I took the exam, I was like, oh my goodness, there's even more stuff that I don't know after this. So, uh, it was a good start laying some groundwork for my ongoing training. And it's always changing, as you know. We have a couple of conferences a year and we don't cover all the new codes. So
yeah.
there's so much more.
Well, and your perception. So my question, next question was going to be, how would being a member of AAPC and being involved with us help other physicians? But like you and Dave were saying, that may not be for everybody. Your vision is beyond your clinic. You're thinking, how can I help healthcare overall?
Absolutely. And regardless of a certification, there is plenty for AAPC for a physician. And I meet some of them that have come to the meetings, maybe some folks that are starting a new practice. They may have, I mean, you can get a lot of good learning going to one of those AAPC conferences. It's amazing. And so now they might get a little overwhelmed because they're like, oh my goodness, these coders are so smart, and like I'm never gonna get this. But the truth is, well, one, they might meet somebody that can help them there at minimum. So because this is not something you can do on your own. This is a team effort, like the whole thing. So the coder is just one of the members of the team.
Yeah, absolutely. So I'm kind of not to change gears too much, but I kind of want the audience to get to know you at more of a personal level and understand some interests and stuff like that. Can we ask you some rapid fire questions, Alex?
Oh goodness,
Let's
here we
go
go.
ahead.
Is that
This is where I
okay?
start getting
Yeah.
nervous.
Okay. It's gonna be really simple. We'll start out really easy. So like, do you have a favorite sports team?
Um, I've got to be careful from Georgia. But I guess when the UGA football team makes its way to almost winning again, uh, you've got to pull for them. It's almost a religion.
Nice. Yeah, football's big in the South. I mean, I lived in Texas for a little while, and those high school stadiums were like the size of college stadiums. I was so impressed. They had the big uh balloon helmets that they'd run through with, all the stuff exploding. I'm like, this is like an NFL game and it's high school.
So, but I honestly, I don't take the time to watch a lot of that stuff. But maybe
Yeah.
the finals I'll get to. But the local high school and the local college that I help support medically, I also, of course, pull for my home people.
Yeah. So awesome. Besides sports teams, what is like a favorite hobby or interest that you have that's not related to your profession?
Okay. Everything's connected. So as a family doctor, we like everything. But um, when I was younger, I grew up kind of in the mountains, and every now and then we would get to go to visit a relative and get to play on the water. And I never got enough. Like you could just, I could be 10 hours on an inner tube and I would not be tired of it. And so I wanted to be near some water. And so there's a little lake here. And so we've kind of our families gotten to grow up kind of on the lake, but we um, have integrated water sports as part of our just outreach stuff. So we host a lot of beginner water ski, and uh, we had a little ski school that we ran, and it's like in a small town, you can get to places fast. So I might take a medical student out during lunch to go out on to do something on the water, and so really enjoy stuff like that. And just, but it's all part of and I'll teach class out on the water too, for medical students. So
That's really cool.
I'm going to try to peel back the layers. Dave, I know where you're going with this, but everything that Dr. Church does revolves around his passion, healthcare. But Dr. Church, when you're not, like, are you a reader? Do you like to go out on hikes or?
So I do. I like hikes. We have the Appalachian Trail going through our community. Somebody gave me this book. That's my my today
Reading
read.
material.
That's not light reading for other folks. So I this is really kind of my hobby too. Like, I just got in at midnight last night from Washington, D.C., trying to, how can we help our payment stuff not break, in the next few years as it's predicted to do. So there's just no other reason for me to be part of this other than I am enjoying it. So that's my golf and hobby. I'm having a great time being part of these conversations.
I love that. I love that what you do and what brings you joy is also the thing that you can do as a profession to also provide for yourself, but provide for other people on your staff. And like you said, it's all connected. That's a beautiful thing. I
It was
don't think there's a lot of people that live that way. So that's
yeah. There were some other doctors who were in DC with me and do some other things, and I said, well, why don't you bring your family with you? It's like, oh, we could never do that. So like, I take my, like, it was a while. We finally went on a trip, but a couple years ago, and my kids said, now, which meeting is this for? And so I have tried to make participation in things like AAPC and these other entities that I'm part of, not something that takes away from my family, but something that enhances my family experience. They would have never gone to do things like this had I not been part of, like, I mean, we went to Zion National Park before this last meeting in Vegas, and we just came early and went and traveled somewhere else before the meeting. And that was, AAPC helped me do that. Otherwise, you could work all the time, but we didn't. So it's really a something that brings my family together, not apart. So I'm not just out around the country doing all this stuff and leaving my family behind. I couldn't do it without them.
Christy Walker left this comment in the chat. She says, I think it would be helpful for the provider to understand the documentation requirements to be able to select a code. It's not the coder being picky. When I read that comment and what you said earlier about a physician doesn't need to have does not need to have the full CPC training. Have you ever spoken with Ray or the executive team at AAPC about a course or certification that maybe isn't the full fire hose, but can help them through their career?
Well, I mean, if anybody was part of the session at AAPC HealthCon, like, it was all 70% of those questions were about documentation, and I do think we need
the E&M panel.
Yes, at the E&M panel. So I do think we need to figure out a better way to communicate that in a believable, condensed format that we can apply, but it is so hard that the doctors are still trying to keep up with the latest medicines, and I mean, I teach this stuff with our residency program and with some students, and that's with me being there on a regular basis. But most programs don't have me. They're doing the best they can. Some of them don't even know who their coders are. So I would challenge you all, if you're part of a teaching program, make sure they know who you are. They want to learn stuff. They don't want to do it poorly, and they don't want the nasty grams. Be proactive and share with them what some healthy looking notes are, not just how bad you are. um, and some shortcuts, not shortcuts, some right cuts. I mean, if you already know that two chronic conditions and active medicines, prescription medicines would qualify for a level 4, you don't need to spend 20 minutes counting up data points for E&M, for example. But then finding some examples of just some narrative that helps you know that there was a complication of the medicine or this disease status. And so that's kind of what I emphasize with my residents, and we'll pull out a word and like, what did this tell you? What have you learned? And I was like, and so in the doctor's minds, they have said it because another doctor, well, of course this is what's going on. And I could read that, but they don't realize that the coders aren't allowed to do that. And so they might even think they're doing a good job, but they're obviously not. So it's going to take some chipping away. We can do
Yeah.
it.
Yeah, we may have to recruit your services for a mini course, a
Well,
mini.
this needs to be much bigger than me. We've got to make sure that we've got a whole army of folks that understand and how
Yeah.
we can make this more straightforward. It shouldn't be so complicated. And it's really not complicated, but with that test being so hard, it is scary when we're talking about, I mean, I think a lot of doctors like, we'll just let the coders handle it. And because they maybe have given up.
Mm, yeah. Yeah, well, I'm remembering the documentation training for physicians that we did during the ICD 9 to 10 transition. And we brought in a physician to be sort of the spokesperson for that little training course that we had. But that was just mainly for the transition to introduce, hey, this is what the new code set's going to look like. This is what each of these characters represent, all of that. But to just have a separate sort of mini course just to help physicians. But like you said, it needs to be tailored for that audience, right? It needs to be concise. It needs to be effective. Yeah.
But we also don't want a canned language. We want it to be, and there's some ways to make sure you're compliant as well, and not having to worry about that when you're trying to just take care of people.
Dr. Church, we're getting close to the top of the hour. You have an audience of coders that are watching. What advice or tip would you give to our coders that are watching as far as maybe how they interact with their physicians or operate from knowing how a physician may look at things? Do you have any thoughts or any advice on that?
I do. I think as smart as some of those doctors are, we know none of us operates well when we get a whole big packet of information. And so if you can give them some actionable nuggets that it's not in the middle of here's how bad you are, like that's just easy for them to apply, I think they will just embrace that. And there's some other lectures that I give for some other topics just on some like risk adjustment stuff. And then for example, they were reviewing how to code properly for obesity. And it's like, oh, by the way, there's a counseling code that you can do for this, and here's the requirements. And even though I was talking about the ICD-10 coding, somebody contacted me and said, oh, we're already using that billing code. And that was not what the lecture was about, but they hung on to that as an actionable item. And so I think if you can add in some things that are meaningful and relevant to them and just know a little bit at a time, even if they say they're capable of learning it all at once, just know they're not. And we've got to keep on going back and back and back to them and reinforcing their good behavior and anyway, I think that's one of the keys. But if I had all the answers to that, we would probably not have these questions. I think we're trying to figure out how to convey this across the country, and then we've got AI trying to help us do the same thing. And there's some neat things happening there, but if you don't say the right things before your note comes up, and that can't help either. So
Bad information in, bad information out.
That's right.
Good information out.
There's
But
a
I think
comment.
as a coder, if they know your heart, that you're just trying to help the practice thrive and help them thrive, it just changes everything. And and yeah, if you it is hard if they're not respectful to you, then I guess if they're not going to be nice to you, then I guess they won't get those nice nuggets of information.
Caitlin Brock, who used to be on the AAPC staff, doctor, I think you've likely have met her. She left the company recently. Caitlin, I know you're watching. We're still trying to get over your departure, but she says this, and this is in line, I think, with what you're saying. She says, I created a tip sheet for my family docs on the codes and documentation best practices and tips with samples. So just trying to make that connection, knowing that it's not going to happen overnight.
Yeah, and just it's not oh, I gave you your tip sheet a year ago. That's not going to work either. We know from adult learning, you have just got to revisit this stuff and come back with a little bit more, and a little bit more. This is a marathon, not a sprint. You just can't do this, and this is like a foreign language that you have to develop. And I think the same thing is most of the doctors have a very poor educational history when it comes to billing and coding. And they might say they had a great training, but it probably wasn't.
Yeah. Well, doctor, this has been such an incredibly informative broadcast, and we've had a lot of great comments in there. Thanks to everybody for participating. Doctor, we'll let you go, and we will see you hopefully in Philadelphia. Will you be there?
Yes, I'm planning on being there. Now, one last little plug. I think I told this before, but if you're having troubles, questions about a code, please submit your observations and speak those up, because I have already been able to make some changes to our code set based on feedback from members straight to me, and I'm happy to play that role. Anyway, it's really, you do make a difference.
Is there a best way to submit those?
Well, I mean, I think through AAPC is a good way as well. I mean, we all have those same channels to get to it, but if you don't speak up, we will not know about it. So,
Okay.
but yeah, you're welcome to share my email address as well. But whatever mechanism to get to me is fine. And Ray can get to me, and those, but Ray has the same channels to get those, to bring those issues that are kind of recurring, to bring those to the forefront.
You're welcome to ping me on the AAPC Alex Facebook profile, and then I can forward any messages to Dr. Church. And are you a LinkedIn person?
Yeah, I'm on LinkedIn. Connect with me. I love to connect with my coders on there too. Sometimes I'll follow you and I'll send you a little great job on such and such, and it's fun to be connected with you all.
Okay. Well, Dave and I are going to wrap up the webcast. Doctor, thanks so much for being with us. We will see you in a few months in Philadelphia.
Great. See you then. Bye-bye, guys.
You're a good man, Dr. Church. We'll see you soon.
Take care.
All right. That was great. Dr. Church was awesome. We need more of that, Dave.
Yeah, such a good guy. Just in all the different ways, professionally, personally, he's just a really good guy. So
yeah, and have someone make that, well, someone within AAPC. I consider him within. We rely on him so much to show us how we intersect, both on the clinical side and the revenue side. So very cool.
Yeah, and a beautiful example of that too, because I feel like you hear things maybe as a young coder, or you have a few like maybe prickly experiences with a physician or whatever, and that can maybe paint your perspective of it. It doesn't have to be that way at all. It doesn't have to be a battle between you and the physician. It can be a synergistic, cohesive relationship. But that does go both ways. So that always takes some self-reflection as well, and be like, okay, well, how am I showing up? Maybe they reacted this way to my, like you're saying, dumping a big stack of, here's what you need to be doing. Here's what you did wrong, right? It always just causes us to kind of do some self-reflection and see where we can improve.
Yes. And okay, my final thought is hearing him talk about how difficult the CPC exam is. it scares me from wanting to take that step. Because we've talked about it, like, and sometimes our members will say to us, "Hey, you guys need to step into it," and that just he just increased the intimidation level by 50.
Yeah, if Dr. Church struggled with it, I think I'll wait. I'll wait
Yeah,
until soul really calls for that.
yeah,
But congrats to everybody out there who, I
yeah,
mean, that's probably the vast majority who's taken that test and passed.
yeah,
Even if it took 3 times, Caitlin, or whatever. I mean, you have 5 credentials now. It's awesome. Just keep at it. And I love this. We have such a good community. So
yeah. Awesome, Dave. Hey, you be safe up in Northern California. Enjoy
saw Bear
the mountains.
yesterday. Yeah. I literally was like pretty close to it. Took some pictures. Yeah.
Awesome. I've got graduation week. My oldest is graduating from high school. Makes me feel like time is moving at warp speed. So, but hey, we'll catch you up soon.
Sounds good, buddy. Enjoy that graduation. We'll see you.
Thank you. Bye, everybody.
Thanks, everyone.